Medulloblastoma is a rare and aggressive type of brain cancer that primarily affects children and, less commonly, adults. It originates in the cerebellum, the lower back part of the brain responsible for coordination and balance. Medulloblastoma is characterized by the rapid and uncontrolled growth of abnormal cells within the brain. Standard of care treatments for medulloblastoma. The treatment of medulloblastoma often involves a combination of therapies, customized based on factors such as the patient's age, overall health, and the specific molecular subtype of the tumor. Standard treatments may include surgery. Surgical resection is typically the first step in treatment. Neurosurgeons aim to remove as much of the tumor as possible without causing significant neurological damage. A total resection, if feasible, can improve outcomes. Radiation therapy. Radiation therapy may be administered to the brain and spinal cord to target any remaining cancer cells after surgery. This is particularly important in cases where complete tumor removal is not possible. Chemotherapy. Chemotherapy drugs are often used in combination to target and kill cancer cells. These drugs can be administered orally or intravenously and may be given before or after radiation therapy. Stem cell transplant. In certain cases, a stem cell transplant, also known as a bone marrow transplant, may be considered. High-dose chemotherapy is given to destroy the remaining cancer cells, and healthy stem cells are then transplanted to help the patient recover. Prognosis for medulloblastoma. The prognosis for medulloblastoma depends on several factors, including the patient's age, the extent of surgical resection, the presence of metastasis, and the molecular subtype of the tumor. Here are some general insights. Stage 1. Medulloblastoma. In Stage 1, the tumor is localized within the cerebellum and has not spread. With complete surgical resection and appropriate treatment, the prognosis for Stage 1 medulloblastoma can be relatively favorable, with 5-year survival rates often exceeding 80%. Stage 4. Medulloblastoma. Stage 4 indicates that the cancer has spread to distant parts of the brain and spinal cord or other organs. The prognosis for Stage 4 medulloblastoma is less favorable, with 5-year survival rates typically ranging from 50% to 70% or lower. It's essential to remember that these are general statistics, and individual outcomes can vary widely. Advances in treatment, including targeted therapies and molecular profiling, have the potential to improve prognosis and long-term survival for medulloblastoma patients. Promising therapeutics for medulloblastoma. Ongoing research in medulloblastoma is focused on identifying targeted therapies and immunotherapies that can improve outcomes while minimizing side effects. Promising areas of research include molecular subtyping. Medulloblastoma has distinct molecular subtypes, each with unique genetic characteristics. Tailoring treatment to the specific subtype may lead to more effective therapies. Targeted therapies. Researchers are investigating drugs that target specific molecules and pathways involved in medulloblastoma growth. This personalized approach aims to disrupt cancer cell activity while sparing healthy tissue. Immunotherapy. Immunotherapies such as immune checkpoint inhibitors and CAR T-cell therapy are being explored in clinical trials for medulloblastoma. These treatments harness the immune system's power to target and destroy cancer cells. One website to research clinical trials for medulloblastoma is onclive.com.a. Variety of promising integrative treatments against medulloblastoma are described in Cancer Self-Defense 101. Quick tips to help you survive. Challenges in treating medulloblastoma. Medulloblastoma presents several challenges, contributing to its status as a tricky cancer. Pediatric population. Medulloblastoma primarily affects children, and treatment can have long-term consequences on their cognitive and physical development. Highly invasive. The tumor's location within the brain makes it challenging to remove completely without causing neurological deficits. Metastasis. Medulloblastoma can metastasize via cerebrospinal fluid pathways, leading to the spread of cancer cells to other parts of the brain and spinal cord. Risk factors for developing medulloblastoma. The exact cause of medulloblastoma remains unknown, and there are no well-established risk factors for its development. It often occurs sporadically, without a family history of the disease. Some genetic syndromes and mutations have been associated with an increased risk, but they are rare. Organizations and resources for medulloblastoma. Several organizations and resources are dedicated to supporting individuals with medulloblastoma and their families, as well as funding research efforts. Some notable organizations include St. Jude Children's Research Hospital, provides comprehensive care for pediatric cancer patients, including those with medulloblastoma. American Brain Tumor Association, ABTA, offers resources, support, and information on brain tumors, including medulloblastoma. The Pediatric Brain Tumor Foundation focuses on pediatric brain tumor research, support, and advocacy. Children's Brain Tumor Foundation provides educational resources and support for families dealing with pediatric brain tumors. Individuals diagnosed with medulloblastoma should consult with healthcare providers and consider participation in clinical trials to access innovative treatments and contribute to advancing our understanding of this complex cancer. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.